Good morning and welcome to our final panel of our two-day workshop. I want to thank everyone for sticking with us on a rainy Friday morning. This is, I think, an exciting effort as we look at opportunities in upgrading the food and physical activity requirements, thank you, in our school-based settings. Excited today to have Rodney Taylor, Director of the Nutrition Services for the Riverside Unified School District in Riverside, California, a true pioneer in the farm-to-school pathways for food so that we get healthy opportunities for our kids. He'll provide us with a successful case study. Also, Ms. Arnell Hinkle, Founding Executive Director of the Community Adolescent Nutrition and Fitness Organization, CANFIT, a nonprofit organization supporting school providers and community-based organizations for enhancing nutrition, physical activity opportunities, and policy support developments. If I can, I want to go to the framework that is in the Accelerating Obesity Prevention document, and it really is important for us to think about the environments and behavioral settings in which our kids and families live, the opportunities for individual efforts like we heard yesterday afternoon from our clinical outreach efforts, as well as the population-based approaches, and then looking at the health outcomes, because this is not in isolation. This is part of a societal threat of obesity to our economic well-being, to our productivity, to our lifetimes, and to our communities. The vision, and I put this up intentionally, I asked for a copy of this slide yesterday because you'll see what is in the center of the picture. As this threat to our health and well-being emerged in our awareness a little over a decade ago, many of us focused on where kids spent the most of their time, in the school-based setting. And actually, when you look at communities, the school is frequently, particularly in smaller communities that have maybe lost a major employer or lost their hospital, the school is the remnant of the community identity that is present. It is the place that parents turn to for help when their children are having educational difficulties. It's frequently a place that sends the kids to the medical facilities because they think they're having medical problems. And it is a center point of, if you will, what researchers probably have the most difficulty actually assessing, getting in somebody's head to understand what makes them get excited about doing something. Challenge anybody about their high school mascot on a Friday night in a rural community anywhere in the United States, and you will get an immediate reaction that is unmeasurable in terms of any research paradigm that you can find. So the school is an important setting, but I want to actually move back just for a second because I think the obesity effort that we are under together and that many of you have been in for a long time was placed on top of a society that did not have equity in place. So the focus of this conversation today about how do we accelerate our advances and how do we broaden our reach to make equity be an outcome is actually a challenge that goes on top of a 20th century foundation that was not present. We have unequal assets across the United States. The median household income in Mississippi is $39,000 a year. The median household income in Maryland is $69,000 a year. Do we expect the same outcomes? And you can go into communities, you can go within communities where that income inequality is incredibly present. We've had implicit racism that's still in our societies based upon explicit racism that has been in the past. And Lori, I'm concerned that we have exploitative racism that is going on now in our digital media from your presentation. In the South, anyway, we've had a history of segregation, if not enslavement, which continues to be present. Not necessarily actively supported, but present in our history that is an important effort. We've had urban blight in cities nationwide. We've had cultural differences, independent of race. We have a very strong propensity to like fried food in the South. It is hard, to get baking going when the frying is faster, tastes better, and it's what grandmother taught me to do. So we've had cultural differences. And finally, environmental inequalities, both with respect to exposures, but also with respect to how our communities have developed with suburbs and inner cities, again, emphasizing the segregation and the inequalities. And finally, we've grown up in a capitalistic society that frequently was unfettered, sometimes exploitative, and those have a direct impact on our health. So when we focused on the schools, why did we think we had a even playing field to start with. School-based funding nationwide largely comes from property taxes. Property taxes are not equal based upon those inequalities we just talked about, and so therefore the assets, financial assets of schools are very different from the starting point. There are different community resources. There are different parental education experiences that in a transgenerational way have a direct impact on the child's educational outcomes and also probably a direct impact on the child's health outcomes. And so I think these are important things that as we entered the 21st century and we became aware of what I think is the major health risk facing our society, we needed to find a way to actually address childhood obesity, but also close the inequality gaps in disparity. But it was not a tabula rasa. It was built upon a society that already had these issues. What I'm proud of is this team, the team that's on the web, the team that's not with us today, over the last decade has started to have conversations that never happened before, and conversations that have started to build an evidence base that are going to guide us of where we need to go in the future. We entered the schools in early part of the last decade, just as No Child Left Behind put on performance indicators without consideration of the social determinants of health or education or any other aspects. And we had administrators in schools move from physical activity, arts, and music to support the hard sciences and the reading materials. We've got 60% of elementary schools that actually increased instructional time at the expense of those other classes. We've got 40% of school administrators that report that they eliminated recess and physical activity in elementary school to focus more on the measured outcomes for education. And luckily, over the last decade, we've got a new Senate proposed bill that brings some of those issues back. We will see whether the political process supports that, encouraging states to expand art, physical education, and pre-kindergarten programs. We identified some other federal programs, Safe Routes to School, through the transportation issue that was used to change environments around school to make it more conducive to physical activity. We had not only changing the environments, but virtual school buses where people walked. We even had some innovative principals who got the school buses to park half a mile away on sunny days so that those who rode the school bus got a mile's activity one way or the other. But we also tripped across this issue of some of our colleagues, some of our advocates that would be with us were threatened. Funding for Safe Routes to School competes with trail programs, competes with some of the other activities around recreational trails and transportation enhancements. And as Safe Routes to School was successful, we had concerns about gentrification displacing minority populations and lower income populations in their neighborhoods because the property values went up and the individuals came in to replace those individuals, buy them out because the value was seen to be greater. So we've struggled with this in some of our efforts. We've had private sector efforts. The Alliance for a Healthier Generation in 2004 had a breakthrough agreement with the beverage industry to reduce sugar-sweetened beverages in schools, only for us to find out a couple of years later that was just the distribution networks that they controlled. 1/3 of the distribution networks is not under control of the food and beverage industries, frequently in some of the lower income and minority communities. So some of these challenges, as we've made 2 steps forward, we've had 1 step back to learn from. The Healthy Schools program has been exciting in that we have 18,000 schools that are voluntarily moving forward, and great local stories of local champions using that as a vehicle to make change, even when statewide policy or the federal policy did not necessarily support that. And finally, we have new and innovative efforts. In our state, we have funded about 127 joint use agreements where for $5,000, getting the city and the school officials to come together and think about how they use the limited assets they have in a joint way. So that in one community, we have a gym that in the daytime is the school gym, after school is the community gym, and on Saturday morning the faith-based organizations are using it for their Upward Bound basketball program. So a common asset shared by 3 different groups, building forward momentum going forward. I'll leave you with this just to say we are bringing together a divergent set of issues: income inequality, racial issues, environmental justice, capitalism, different things that we must solve in order to actually reach the protective efforts that we want for our interest in children's health. Now, this panel will be on strengthening schools, and I mentioned that we've got about 10 years of effort, and we've probably got the best evidence base of what does and doesn't work around childhood obesity because the environmental setting is relatively controlled. Kids show up for school, there's a structured curriculum, you can control what they're exposed to for lunch, how many minutes of physical activity. I'll be the first to say, I don't think this is going to be the solution. It may be the heart, but it's not going to be the solution because where kids spend their time the rest of the time, before and after school, is equally important because it's their lifelong habits that they are getting in place to lead a healthy outcome. So the recommendation number 5 is that the federal, state, and local governments and educational authorities, with support from parents, teachers, and the business community and the private sector, I think we tried to say everybody, should make schools a focal point for obesity prevention. Because up to half of the time that the children are awake, they're spent in school, and probably another quarter of the time before school and after school, they're spent in the school environment or with their friends that have been at school and experienced the same exposure. 3 strategies to require quality physical education and opportunities for physical activity in schools, to ensure strong nutritional standards for all foods and beverages sold or provided through schools, and to ensure food literacy, skill development in schools, and by extension before schools and after schools as part of the extended influence of the school environment. So with that, I'm excited for this panel. Let me invite Rodney to come up and give us his case study. This is an exciting achievement in a challenged school district, and really want to appreciate your presence here. Look forward to your comments and our subsequent discussion on the panel. Welcome, Rodney.